going to go ahead and introduce our speaker today. We are really pleased to have Jana Martin here to present to you. She's the Director of Healthcare Partnerships with Mom's Meals. She's going to take us through how to take advantage of this meal delivery benefit that comes with your enrollment in our MyCare plan. So, Jana, I will go ahead and turn it over to you. I'll stop sharing so that way you can go ahead and put your presentation up.
Excellent. Thank you, Elisa. Can everyone see my screen? Okay.
Yeah.
All right. Perfect. Well, thank you for the introduction. As Lisa was saying, my name is Jana Martin. I am the Director of Healthcare Partnerships here at Mom's Meals. I also am a registered dietitian by trade, so I am the only clinical director on the team. I come with a wealth of knowledge, as I say now, because I think I've been an RD for about 17 years or so. My specialty is in diabetes and renal, is where I sort of lived in the clinical space. I worked for DaVita for about 10 years or so, 9 years maybe. And so I really have those folks have a special place in my heart, but I also have a business acumen side of me. So I kind of get both sides of the coin here at Mom's Meals, but I've been here since July of 22. So a little over a year and a half, and loving every minute of it. So I am here today to give you a little bit of a Mom's Meals 101, a rundown of your benefit and how Mom's Meals works. So really just kind of giving you a small introduction, talking about Mom's Meals difference and the 5 pillars that we stand on. We'll talk a little bit about why this benefit is important for your members and how the Mom's Meals solution really works to your benefit. So to kick that off, Mom's Meals was started because Barb Anderson, who's one of our co-founders, wanted to make sure that her mom and her mother-in-law were getting nutritious meals on a regular basis. So it's a family-owned business. It was very small. I always say that we're very small and mighty. But it really kind of, started with Barb wanting to just be able to find a way to provide nutrition for her family. And so her mom and her mother-in-law were both widowed. They were living alone and they ended up having a chronic condition and started losing some unintentional weight loss. So because of that, they were not eating well. And for those of you that have family members or if yourself, when you live alone, it's hard to cook for one. So that's kind of where the business idea grew from there. Mom's Meals' first contract was with a very small agency in Iowa for rural and remote folks that were not near a meal route or a congregate center. So essentially, the company really was born out of this desire to care for people, and that passion continues to be with the company to this day. So we are very mission driven. We truly feel that we are improving life through better nutrition at home. And so our footprint is pretty large for being such a small and mighty company, but we are the national provider for home delivered meals. The company was founded in 1999, so we've been around for about 25 years. And we have facilities all over the US that brings our reach pretty far. So we have kitchens in Grinnell, Iowa, along with our home office is in Ankeny, so that's right outside Des Moines. We have a kitchen in North Jackson, Ohio, and a brand new kitchen in Oklahoma City that has been doing about 2 to 3 million meals a week. So they're pretty large down there in Oklahoma City. And then we have fulfillment centers to be able to, take the meals from the kitchens and then distribute them and deliver them throughout the country. We have one in Ankeny, one in North Jackson, Las Vegas, and in Georgia. And so our reach is pretty big. We have about 2,200 employees at the company, and we did over 60 million meals last year. So we're pretty large when it comes to feeding the country across the country. We also deliver to Hawaii, Puerto Rico, and Alaska as well. So definitely leading nutrition company here at Mom's Meals. And please, if you have any questions, please let me know or throw them in the chat too. It seems like it's very formal. It's not formal at all. So you can come up, throw your questions in the chat and I can answer those as we go. So what makes us different from all the other meal companies that are popping up around the country? We have 5 pillars that we stand on. So, and I'll just kind of give a quick overview and we'll go through each of these differences here in a second, but we are refrigerated meals. So we are not frozen. They are refrigerated and in the refrigerated fresh category of food. All of our meals are medically tailored. We have choice every meal, every delivery. We deliver to any address, as I was mentioning previously. And then we have a compassionate customer care service that is 100% live. So there's no IVR calls or anything. So anytime you call into Mom's Meals, you will be speaking to a live person. So if we take a deeper look into each of these pillars, our meals are fully prepared. As mentioned before, they're refrigerated, they're not frozen. And so this is really important for you and your members to know, because that means that your members who struggle with activities of daily living, right, are going to have an easier time taking our meals right out of the refrigerator and heating them in less than 3 minutes, especially those folks that come straight out of the hospital. You know, they're not feeling well, they have a lot to juggle. This just makes it really easy. They really can just decide right away what they would like to eat when they are ready and then eat it without having to plan ahead, or they're gonna have to thaw their meals or wait for wait in the kitchen too long while the frozen meal is cooking. All of that plays a really big role into our design. And so the members really can just decide within minutes what they want to eat and they just heat it up and it's a hot, delicious, nutritious meal that fits really nicely into the refrigerator. So we've surveyed clients for many years. They've really repeatedly continued to tell us that they prefer refrigerated meals over frozen that they've tried. And our most recent survey showed 71% rated our meals better than frozen. So this has been pretty consistent throughout the years here at Mom's Meals. And finally, our refrigerated meals are made in with high quality ingredients in our kitchens. And all of the kitchens are USDA inspected with the FDA oversight. So each kitchen has 1 to 2 USDA inspectors every day. And so this oversight really ensures that your members are receiving meals that really have been produced with the highest quality of compliance with regulations that are governed for food production. So there's really a lot of red tape around food, as you can imagine. So this really provides this gold standard in food safety. And really at the end of the day, we know that, there's a grandma, a grandpa, a mom, a dad, a sister, a brother eating the food. So we really want to make sure that it's meets those standards of the USDA and making sure that it's safe once it gets out the door. Our second pillar is medically tailored meals. And so in addition to our great tasting and meals and client satisfaction with the refrigerated meals, we do offer extensive choices of medically tailored meals. And these are really designed for folks that have chronic conditions. Or any type of like special dietary preferences. So we have a menu of 9 different options listed there on the right. And our most common is our general wellness menu. And that is just a portion controlled, low sodium, low fat, typically somebody who's not focusing on a chronic condition chooses that menu as well. But for those that need a specific nutrition support for their chronic condition, there's a heart-friendly, renal-friendly, diabetes-friendly menus as well. They're all medically tailored and they're all 400 calories or more. So it's a nice, solid, on a caloric level, it's a nice, nutritious meal that really provides the nutrients and the energy that members need to stay out of the hospital. So once the whole goal is to not have them go back in within 30 days. And if you get quality nutrition in a person, you have a 90% chance of keeping them out of the hospital. So all of our meals are 400 calories or more. And then on the menus that folks get, it really indicates that, there's icons that indicate the meals that are supported through chronic conditions. We give a small description of those meals and sides. The spoon indicator on the menu is a favorite. So it's been indicated favorites. And then we have the nutrition values also there too. So everything's sort of laid out for everybody when they see a menu. And then our third pillar is choice of every meal, every delivery. So we know that food is very personal to everyone, right? If you think about the last time you went to a restaurant and you're going to a restaurant because you want somebody to cook for you. That was me last night. I'm a hockey mom and I am over hockey. It's ending here in 2 weeks, but it's a lot. And so I'm like, I can't cook tonight. I've been in the hockey rink for the last 5 days in a row. And so wanting somebody to cook for me, right? Go to a restaurant, we get to pick what we want. Imagine if the waiter just set down like the meal of the day for you, and that's all you had, right? You probably wouldn't go back and you would probably light them up on Yelp or something, right? Because that's not why we go out. So with Mom's Meals, we really want to make that experience for the members to be able to have the choice and to choose each meal, every meal. And we see that it promotes consumption, right, of the food. It provides them dignity. It leads to less waste. And, and with that overall, it just better impact in their health and well-being. So 96% of our members customize their meals. The other 4% just like us to pick them for them, and just get a randomized cooler. But the majority of folks, they pick their meals every time, which is great. The fourth pillar is delivering to every address. So like I mentioned before, regardless where your members live, Mom's Meals can deliver to any address nationwide. We use third-party couriers, the UPS and FedEx, to help us with some of those remote folks. And then we also have our own delivery team that has temperature-controlled vehicles that will go out to higher concentrated areas. But Mom's Meals does have trucks that will go and deliver to members. So we definitely are able to reach, and we, like I said before, we do deliver to Puerto Rico, Alaska, and Hawaii. And some of those obviously are not trucks. So we use airplanes to be able to get down to some of those places, but pretty cool. When we have like the Hawaii fires, we were able to support through food with those, and it's a pretty neat process that we have with the UPS and FedEx folks out there. And then lastly, our fifth pillar is our customer care team. So we have two teams that are part of our customer care service. They're both live. One supports you or the health plan, the partner, that's our intake team. And one is for the member. So the members or clients call in for a customer care team. Both departments are bilingual, so they in English and Spanish. And then we also have a translation service over 160 languages. So if that is indicated on the referral form, we're able to support that. And truly, these teams have a culture of caring. It's something that we screen for in the hiring process. So when we are looking, for customer care folks, we really don't look for like call center experience. That really doesn't matter as much as knowing that they really care about people, right? So we look for things like volunteer work or working at home health or nursing homes or taking care of a loved one, to really focus on that empathetic piece, because that's really where we make a really big impact with your members as well. And in some cases, we may be the only people that your member talks to for that day or a couple of days. And so, we answer a bunch of questions. We also help them customize their next order. And then we talk about, we hear a ton about grandkids and pets and weather. So our customer care team members really enjoy and look forward to interacting with the members. And a lot of times, if they're on a longer term benefit, they get the same customer care rep each week. So they develop a nice little relationship there as well. What else? We provide annual cultural competency and aging training along with disability awareness training every year. And they're also safety trained. So if they hear any health or safety concerns, they are able to take action with some of those those health and safety concerns, like if they hear I'm not feeling well today, or I fell, if speech is being slurred, right, or they're acting strange compared to what they normally do, we're able to alert care management, and or there's been multiple cases where we're the ones calling 911 to help those members as well. So that is the fifth differential pillar that we stand on here at Mom's Meals. And then moving right along, we have many programs. So these are all sort of the different lines of business that we touch, but post-discharge is the most common. And that's what Western Health has right now, but we do have chronic care benefits that are about 12 weeks long. That's really focusing on folks that have a specific chronic condition. We have a ton of diabetes, heart failure, renal disease, maternal health programs going on right now. Since I'm the only clinical director on the team, I hold all the pilots. So we have a bunch of clinical pilots. There's about 25 of them right now, going on across the country that, a lot of great things are happening within the food as medicine space. So there's, I have a dental pilot. I have a rheumatoid arthritis pilot that they're relating high sodium intake to, which is very interesting. The dental pilot is focusing on gum health for those folks that have diabetes, because it actually improves infections and blood sugar control. So a lot of really cool things happening that are coming into the world. And once those pilots are done, usually we are able to publish and present the findings of some of those pilots. So more to come, but that's the other hat I wear here at Mom's Meals as well, focusing on all those clinical pilots. In terms of the importance of nutrition, so I'll try not to get on my pedestal here, but as you probably know, if the goal is to keep someone out of the hospital and at home, proper conditioned, appropriate nutrition needs to be just the first thing that is given. And that's really because they're not eating well in general, right? If they're not eating well, they're not staying at home and they're visiting the ER more often than being readmitted to the hospital more often, partly because, they have 85% of 65 plus folks have one chronic condition already. The most common is hypertension. So if they're not eating well, their blood pressure meds are not working, and their blood pressure, or if they're eating junk, their blood pressure is high, and so they tend to call 911 or end up in the ER more often. So this slide here shows a team of researchers used a statistical modeling to predict the effects of implementing medically tailored meal programs across the country. And so as you can see, it's predicted that 1.6 million readmissions could be avoided if people with diet-related diseases received medically tailored meals. And that, of course, all contributes to a reduction in overall healthcare spend. So you can see those are really big numbers, but when we tailor it down to health per health plan, you still see a 3-to-1 ROI with the post-discharge meals, because it's really just providing that nutrition for folks to be able to take their meds. There's a lot of medication that you need to take with food. And if you don't have healthy food, your medication is not going to work. So there's a lot of reasons behind it, but definitely makes a big impact. And then this last study here just kind of brings home, and this was an Aspen study about malnourished patients. So again, a high number, 80% of folks are already malnourished before they go into the hospital. And malnutrition is really hard to diagnose. So dietitians are usually the folks in the hospitals screening for it. And it's still, I can't tell you how many screens I've done that they screen that they're not malnourished, and they actually are. And so hopefully that research is coming out. It's getting better as we go, but it's really, really hard to see. And if you do see malnutrition, it's too late. So keeping that in mind, that, malnourished patients are 2 times more likely to be readmitted within 30 days of discharge. And so if you have 80% of your folks already malnourished before they go in, we're kind of behind the 8 ball there. They have a 1.5 times longer length of stay than someone who's nourished. and they are 2 times more likely to be discharged, not to be discharged home independently. So they end up going to a SNF or long-term care after hospitalization. So I always say food is so simple. It's such a simple solution, but it's super complicated all at the same time. Okay, so how Mom's Meals works. So this is just a very high level overview of kind of how it works. So once we get the referral from Western Health, Mom's Meals intake team will then set the member up in our system. The case managers will receive a email within 24 to 48 hours of submission indicating that we got the referral, it's being processed. Once we do that within 24 hours, members will receive a welcome call from the customer care team. And that welcome call really helps them understand their menu options, the benefit, customizes their meals choices, gets their allergies, any delivery instructions for their first scheduled delivery as well. So, and then from there, we deliver, the 14 meal cooler to the home. Once they arrive, members should put them in the fridge right away. So that's told to them. And then they can really, heat and eat and enjoy right away. So meals are typically 90 minutes is the highest that I've seen. And so it's pretty quick and dirty when it comes to that. And then there's also ongoing support. So if members need to call or adjust or have a complaint or comment or anything, they're able to connect right back with customer care as well. So it's pretty seamless and it's quick. So post-discharge meals, we typically get to members, our goal is less than 3 days. We're sitting right now at like 2.3 days. So it's pretty quick where for folks to get meals after the discharge. This is what the cooler looks like. So it's a perishable box with temperature controlled lining, and we have it lined with ice packs and coolers. There's handles on the box so folks are able to lift it easily or drag or however they're getting it into the house. And then you can see the entrees are packed nicely there, and then the sides are packed up onto the side. So each entree comes with a side, whether that's a cookie and an orange or the rolls or the piece of breads or whatever comes along with the tray as well. And so all of that's indicated with the menu that's inside the box. It tells them what sides to pair the meals with as well. And then when we talk about the benefits, so for Western Health for 2024, our Medicare Advantage post-discharge benefit is 2 meals a day for 4 weeks. So the members get 56 total meals. So they're able to choose all of those as well. And it's a pretty robust benefit that you are offering your members. So pretty special for them to be able to get something so simple for 4 weeks. So it's really, really great. In terms of the referral process, so with a care management team, they do it through a manual form, and this is what the form here looks like as well. And they just either email it or fax it into Mom's Meals. So once we get that fax, that's when the process kind of starts of they'll upload them into our system. The welcome team gets the indicator that there's a new member, and then the welcome call goes out and the cooler goes out shortly after that. So one question is, if the member doesn't answer the phone, does the cooler still go out? And the answer is yes. So I get that question a lot. We do not hold coolers until we hear from the patient or the member. So the member is going to get the cooler regardless if they pick the phone up or not, if they're eligible, and we get a referral. So here the case management team can indicate which menu they would like, any allergies, and any special instructions here at the bottom. And that we usually see like delivery instructions down here the majority of the time of them saying like deliver to the back door, or I just saw the other day someone has a really large dog so they wanted to tell somebody that must be a really big dog. But we get all sorts of different instructions under there. So that is how the benefit rolls. They also can get the benefit 4 times a year. So if I didn't put that on the last slide, but if the member goes back in and they have an eligible discharge or inpatient stay, they are eligible for the benefit again. So the goal is to not get them to go back in, but if they do, they have the benefit is 4 times per year as well. And I think that is all of the updates that I have. Does anybody on the phone have any questions or comments for me that I can answer while I'm here?
Hi, Jenna. This is Eric. I'm with Western Health. I work with Elisa. And, you indicated up to 50, the meals, 2 meals per day for 4 weeks, up to 56 meals, but that's can be up to 4 times per year.
Mhm.
So my question has to do with those clinical pilots that you talked about earlier.
Mhm.
Are those meals part of the total? Or are they in addition to?
Like if you do like if someone has a clinical pilot going on,
Right.
yeah, no, it's an additional. Yep. So those pilots, if they had a post-discharge benefit per se, like you put it in the bid, right? If they wanted to target a certain population, whether that's diabetes, heart failure, I get combo, right? I get a diabetes renal combo.
Hmm.
Um, and if they have it in a disease management or already have a disease management program, they wrap those meals into that program in a sense. And so they don't have to explicitly call it out in the bid. So it's a separate program that's running along with post-discharge. So if this member had an inpatient stay, they are eligible, and it's up to the plan, but most of the time they are eligible for post-discharge meals, the 56. And then after that, the case manager will say, well, Mr. Smith, we also have a chronic care program that's going to help you manage your diabetes. Are you interested? Right. And then they get another 12, let's just say 12-week program, and they're able to do that. And most of our programs are what we call transitional. So we teach the member how to do this on their own after the benefit is done. So then they can cook and kind of teaching the fish or fishermen how to fish or whatever the saying is, right? Teaching them
Right,
how to
right.
fish. Yes,
Okay. Yeah, thanks for that response. I appreciate it.
yes, yes. And if you want any more information, let me know. Um, we do have a memo that we hired Fagery, which I think is it's a law firm that gives the plan step by step of how to do a clinical program outside of the bid process. And really use your medical spend to be able to give back to the plan, right? And to be able to give a consistent sort of program to your members to keep them out of the hospital, keep them managed, X, Y, and Z. So if you want any other additional information, please let me know.
Okay, thank you.
Yes. I see a question in the chat here. How often are the meals delivered? That's a great question. Every week. So they will get what is let me go back to making sure that 2 meals for 4 weeks. Yep. So they will get a 14 meal cooler every week. So the intent, and here's the kicker, the intent is to get your members to eat 2 meals a day. If any of you have experience with folks that are 65 or older, trying to do that is like hitting your head against the wall. But some of them do. Not my 95-year-old grandfather. He does not eat 2 meals a day, but the satiety in your stomach goes down, right? So if they get a 14 meal cooler and they say, holy cow, this is so much food. Well, Mr. Smith, like, are you eating 2 meals a day? Because the intent is to eat a breakfast and a dinner or a lunch and a dinner or, whatever, breakfast and lunch, whatever, which way they want. So yeah, it's every week they get 14 meals for 4 weeks straight. Joyce, did that answer your question? You're on mute, but
Yeah.
okay.
I had a question about that. So then every week, are they tailoring their choices?
Yep.
Okay, gotcha.
Yep. So they either can do it on their own. So there's a menu within the box. Coming soon, post-discharge members are going to be able to order online if they want to. So that right now the chronic care folks are able to do that. Post-discharge members, not quite yet, but hopefully here soon. But for now, they have like a menu that they can mail in, or they call. 90% of the folks call because they like to talk to the customer care rep, and then they choose their meals on the phone. Yep.
And
Great question.
just going back to the referral process, so
Mhm.
that is done while obviously they're still in the hospital. So um, in theory, they should, is this something our members need to request
Mm-mm.
to have this referral done, or should they be proactively approaching them and letting them know this benefit and helping them get this referral that's needed?
Yeah, so on the Western Health side, and Elisa, I'm so full transparency, I'm not the director for Western Health, so but I am here to train.
Yeah.
And so I don't know the full process within Western Health. Is it typically what happens is the member goes into the hospital, the health plan or the case management team gets indicated that they're being discharged. From there, the case management team then calls or however reaches the member and tells them about all the different benefits they have available for them. And one of them is the meal benefit. And then
Perfect.
they say, okay, great, I'll send in the form. Mom's Meals is going to call you in 24 hours. And you should be getting your cooler soon. So that's typically how it happens. It doesn't happen, even though I would love it to happen, but it doesn't happen if the patient's still inpatient. There has to be an indicator of a discharge, if
Gotcha.
that makes sense.
Yep.
Mhm. Yeah, yeah. Some providers are able to do it, but it gets hairy because the provider doesn't know if the member has the benefit on their health plan.
Yeah, yeah,
Yeah.
I can imagine. Yeah, because they've
Hmm.
got to facilitate all the different plans.
That's right. Yeah. Yeah. So that's kind of how it works. So this is a manual side. The other processes that we have with other health plans, and whether they're big, small, large, national, it doesn't really matter, but we do have a portal where case management can go online and do it right away. So there doesn't have to be a manual thing. Um, we have SSTP, so we are able to ingest files directly from discharge planners. We have API connections. We have all sorts of different like automation that Mom's Meals can do versus this manual process. So that's something that Western Health is always looking into or trying to streamline. Mom's Meals has a lot of different options that plans can do. The most common is SFTP or the portal, doing it online. The case management team loves the online side. Great questions.
All right. Well, I don't see any other questions right now. So thank you, Jana, for taking us through this benefit. I know that, um, you know, a lot of our members don't always know about this benefit available to them. And,
Mhm.
um, we still love to get the word out and to make sure that they're able to take advantage of this great benefit, especially coming out of the hospital. So
Yes.
thank you for sharing. Um, I also just want to remind everyone we do have another webinar coming up next week on the 14th at 10 a.m. to go over pharmacy benefits with OptumRx. So if you haven't already, please go to our website at mywa.org/mycareevent and you can register for that upcoming webinar. Thank you everyone for your time today. We appreciate you spending a bit of your morning with us. Thank you again, Jana, for your help, and we hope you all have a great day. Thanks, everyone. Bye-bye.
Thanks. Bye.